Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. For access to social gatherings, Edo State government insists on vaccination for residents. Taraba government holds free medical outreach to detect ignorant carriers of COVID-19. And restrictions eased in South Africa as country moves to lockdown level 2. Nigeria recorded 365 infections. The latest cases were recorded in 7 states and the Federal Capital Territory. Lagos, the hardest hit state by the pandemic, topped the COVID-19 infection chart with 209 new cases, followed by Ondo and the FCT. While 8 persons were said to have died of COVID-19 complications on Sunday, the country's total fatality toll stands at 2,598. Let's take a look at the update.
365 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and the FCT, indicating a drop from the figures reported earlier. Lagos topped the infection chart with 209 cases. 88 cases were recorded in Ondo, while 31 cases were recorded in the FCT. Rivers recorded 16 cases, Ebonyi had 11, Kaduna had 6, Ekiti 3, while Plateau registered 1 case. There were 0 cases reported from Benue, Kano, Nasarawa, Osun and Sokoto states. The latest update also includes a backlog of deaths and discharges for Lagos State from September the 11th. Nigeria now has a total of 199,151 confirmed cases. 343 people have been discharged in the last 24 hours, increasing the total number of recoveries to 186,418. 8 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,598. Presently, there are more than 10,000 active cases in Nigeria, while over 2.8 million samples have been tested so far. Over 4 million eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, with over 1.6 million persons fully vaccinated so far. In Africa, there are more than 8 million confirmed cases and over 203,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 224 million, while more than 4.6 million deaths have been reported.
And according to the latest statistics from Edo State's COVID-19 response team, 16 deaths have been recorded over the last 72 hours from COVID-19 complications. Following this development, the state government says it will make do with the threat of no vaccination, no social gathering, starting from September 15. The Permanent Secretary, Edo State Ministry of Health, Dr. Osamoyi Irowa, was speaking during the daily COVID-19 briefing at the Government House, Benin City. He insists that the restriction will be necessary to curb the spread of the virus by preventing those without vaccination from infecting others.
If you're not vaccinated, you can't enter all. You can't enter event centers, you can't even enter churches and all that. We have a security pillar that is already in place, and we have a detailed enforcement plan that is already in place that will come on board by mid-month. That's starting from 15th. So we already have a lot of things put in place to start implementing issues that relate to preventing further spread of COVID. Before any approval is given for such gatherings to hold, we will also enforce the details that have been put in place. The control measures, you must seek approval to have all the protocols in place. Distancing as one of those key aspects of the protocols that we have for you to have any gathering of that nature. That means if the capacity of the hall is a known number, you cannot use that hall for more than 50% of the expected number of that hall.
And to Taraba State, where the government says it will not leave anything to chance in the fight against the coronavirus pandemic in the state, especially as it relates to residents' well-being and the ongoing resident doctor strike. The state government made this known at a free medical outreach to detect residents to encourage them to stick to the safety measures.
It's to create awareness and afford free medical outreach to the vulnerable and unreached population of Jalingo local government area in Tudunwada and a chance to ascertain if they're ignorant carriers of COVID-19. The medical outreach is organized by the state government in tandem with some donor agencies to bridge the gap in healthcare deficiency, as well as improve the quality of healthcare at the rural level.
I think to a very large extent it's yielding results because, as you can see, through that medium, some because of the temperature, they can dictate whether this person is suffering from malaria or if he's suffering from the COVID-19, etc., etc. And so I think certainly the fact that people don't have that access easily through this medium is to go a long way in also making sure that at least we have also contributed our own part of the bargain in the fight against this menace of COVID-19.
The partners are assuring the state that anyone who comes down with symptoms similar to COVID-19 will be separated for proper diagnosis as well as treatment.
For now, the only thing we can do now is to try to look at the safety measures of COVID-19. You make sure you follow the protocol, and then if you are having anything that is common to those elements, you rush to the hospital for diagnosis so that you can be very sure whether that is a problem or it's just a similarity.
While appreciating the kind gesture of the state and federal government towards the fight against the pandemic, the beneficiaries are urging residents to always pay their revenue to enable government to reach more persons. With the state government battling the pandemic, cholera outbreak and vaccine-derived polio at a time when resident doctors are on strike, its hands are full and the help of donor agencies is welcome.
Nigeria has tested almost 3 million samples out of its population, confirming almost 200,000 cases of COVID-19. In September 2020, the WHO announced the emergency use authorization of some antigen-based rapid diagnostic tests, RDTs, to help in testing for COVID-19. However, RDT does not replace the use of the polymerase chain reaction, the PCR. As schools reopen and the country battles a third wave, how does the RDT help stem the spread? Well, joining us now is Mr. Anthony Ahumibe, Senior Laboratory Technical Advisor at the NCDC. He joins me virtually from Abuja. Thank you for joining us on the program.
Thank you, Millicent. Good to be here.
Glad to have you. When and where are RDTs required?
RDTs are required basically when you want to know your COVID results quickly. In terms of where you need to use them, we've advised on using them in congregate settings. That's where people stay together for a long time. We also advocate that people use them where PCR is not available and also in medical emergencies. So these are areas where they can be used.
So in terms of bridging the gap to trace and control the spread of the virus, how reliable are they?
I will say they are as good as the regular testing, the PCR, though we know the PCR is the gold standard. To make sure that we get the results that are as reliable and accurate as the PCR, there are a lot of things we do in combination. That's why we have the algorithm. The algorithm gives us a combination of tests or a process by which the results are actually made very reliable. In addition to that, we also ask people to look at clinical history and then travel history as much as possible to be able to get a very, very reliable result. But ultimately, if all this is done with quality in mind, you can get a result as good as PCR.
Can anyone use RDTs?
Yes, anybody can use RDTs, really. But what we've asked is that RDT be administered by a very trained personnel. At the moment, the kits we have, the antigen RBTs we have deployed, you still have to collect sample through the nose, essentially using the nasopharyngeal method to get samples, which is a bit invasive for a lay person who hasn't done the training. Again, I've mentioned a few things about algorithm and all that. So you need somebody who is trained to be able to administer this. But in terms of who this test is administered to, it's open to everybody who wants it.
In terms of frequency, how often should it be used? And this is also, at what points can we say, okay, it's a must? Even though you've taken or you've tested using RDT, it's now time to use the PCR to confirm a case.
Yeah, generally, because of our population, it's more of a risk assessment because RDTs are meant to allow people do a test and get their results quickly. So at any point somebody feels he has come in contact with somebody who has had COVID or who has COVID symptoms, it's always advised to check yourself quickly so that you can be isolated and get into treatment. Beside that, there are times where you need confirmation using RT-PCR. And again, I mentioned the algorithm that has been put out by NCDC. We advocate for confirmation using PCR when an RDT result is actually negative, but the person is still symptomatic, maybe still having fever or cough, or has a travel history, or has had contact with somebody who recently had COVID. In such a situation, you are asked to confirm using a PCR.
Okay, so finally, I mean, we've been saying RDTs, rapid diagnostic test. Just expatiate, about what this is and, what it does to the COVID-19 virus.
So the good thing about RDTs is that it's something we needed to allow us to ramp up testing. PCR needed a lot of technological input, needed some technique in terms of manpower. But PCR has the added advantage beyond this in giving us an opportunity to get our results latest within 15 minutes. Beside that is a point of care, so it allows you to get into the communities, do your tests, which is actually what we are looking at, community testing. It's integration of testing, so that at the end of the day, everybody who needs tests can have access, and it allows us to actually continue with our strategy to quickly detect, isolate, and then treat those who have COVID. In which case, it helps us improve on our numbers in terms of managing people and being able to manage the pandemic.
So, Mr. Humibe, you're saying essentially as schools reopen, organizations with limited restrictions in place, like the non-pharmaceutical protocols, this does benefit them.
Yeah, it really does. The schools are one of the congregate settings that NCDC continues to ask that RDTs be deployed. First and foremost, having an opportunity to regularly and routinely test the staff, both the academic and the non-academic staff, because these are the people who actually move out of the school environment regularly and have a larger contact than the students. So this is one area it will help. Again, it's also useful for the school to use it to test anybody who has febrile illness, at least just to rule out COVID. If it's malaria, then it becomes easy. And again, like I said, the fact that this is accessible, NCDC can always help the schools in training those who are available to reach, and it will help us just to make sure that we don't have sudden closure of schools when you have one case that is positive.
All right, we appreciate your time. Thank you so much. Mr. Anthony Ahumibe is a Senior Laboratory Technical Advisor with the Nigeria Center for Disease Control. Thank you for your expertise on this issue.
Thank you.
Well, still to come, we go to South Africa as there is lockdown restrictions. Join us again. The United Nations resident and humanitarian coordinator in Nigeria, Edward Callon, has commended the Enugu state government in its fight against COVID-19. The UN resident coordinator was speaking during a working visit to Enugu State Emergency Operations Center, where he interacted with stakeholders in the state's health sector. Meanwhile, on the new cases of COVID-19 in the state, the Commissioner for Health, Dr. Ikechukwu, believes the Delta variant can be combated if citizens become more responsible.
How can we ensure that 70% of the population is vaccinated so that we can reach what the scientists are calling herd immunity? This is also critical, and closely linked to that is the issue of compliance with the non-pharmaceutical measures. We have to ensure that institutions and organizations actually lead and own this effort so that people are able to comply with the non-pharmaceutical measures and also access vaccines so that we can develop the herd immunity that is required to manage the COVID-19. COVID-19 is here to stay with us. As WHO always says, we might be tired of COVID-19, but it's not tired of us as yet.
There is a third wave that we are still riding, and it is showing in the figures that are evident in the data that is being reported by the NCDC on the country that are everywhere. So the response is still as it is, but the numbers are showing that the epidemiological curve is showing the third wave. And that is how epidemics and pandemics run, especially when we're dealing with influenzas. And it is taking its course, it is showing in the data. We in the health sector are putting up our fortified fight. And as you have heard the resident humanitarian coordinator talk about, what people should understand is that people should access vaccines and really comply with the non-pharmaceutical measures.
Away from Nigeria, the South African president has announced the easing of some restrictions that have been in place to curb the spread of the pandemic. In a televised address, Cyril Ramaphosa said due to a decline in infections, an overnight curfew would be shortened, alcohol restrictions would be eased and larger gatherings allowed. He said the supply of vaccines was no longer a constraint and called on people to play their part in stopping the spread of the virus.
With the decline of infections across all provinces, the Ministerial Advisory Committee on COVID-19 has recommended an easing of restrictions on the movement of people and also gatherings. These recommendations have been discussed at the National Coronavirus Command Council. They've also been discussed with our premiers, our mayors, our traditional leaders, as well as a number of MECs in the President's Coordinating Council. They've also been discussed with leaders of political parties represented in Parliament and with faith-based organizations. Based on these discussions and the recommendations and the proposals that have been put forward and the requests, Cabinet has decided that the country, after considering all these, it has decided that the country should be moved from adjusted level 3 and be placed on adjusted level 2.
South Africa's President Cyril Ramaphosa there. Away from the continent, according to the Union Health Ministry, India has reported over 27,000 new COVID cases and 219 deaths in the last 24 hours. The country also has more than 3 million active cases. Following the surge in coronavirus cases in April-May, it appears that mass gatherings were still taking place. The Kumbh Mela, a religious gathering that takes place every 12 years, went ahead as planned in some parts of India. Well, joining us to talk about the situation there is Dr. Vishal Rao, a member of the COVID-19 task force, also the Dean Center for Academic Research, HCG Cancer Center. He joins us now virtually. Thank you for joining us on the program. Tell us, are mass gatherings to blame for the spike in cases, especially the ones we saw in April? What would you say went wrong in India on the COVID-19 front?
A very good evening to you, and thank you for inviting me for this program. I think what we fundamentally need to address in this endeavor of curbing the second wave or the upcoming third wave is very, very relevant for us to understand that this virus is a socio-economic virus. The more we run social activities, the more we run entertainment activities, the more it is going to spread. So overall, I think one of the biggest learnings we've had from the second wave has been that we will need to win this war at home and not in the hospital. And most of what we have been doing today, and I think today, if you look at, for example, I'm representing Karnataka state, which has a population of about 6 crores. Now, even in a population like ours, today the positivity rate is at less than 1%. It's currently at about 0.5 with very few cases coming up each day. The key learning that we have done is now we've moved from COVID appropriate behavior to looking at transmission appropriate behavior, which is a combination of the COVID appropriate behavior plus that of the plus that of vaccination passport.
But recently, the country placed a ban on religious festivals. I know you talked about transmission appropriate behavior, but if we look at the Ganesh celebrations for districts posting higher positive test level to prevent a surge in cases, what other containment measures are in place at this time across the country?
So I think the most important and the most relevant thing that is being done in this unlock phase was the way Government of India has taken up the structured program in order to address various socioeconomic strata and businesses. Now, broadly to put it, the Singapore followed a similar model. It was called the end of the circuit breaker model, where in the first phase of unlock, we continue to do the unlocking by encouraging only economic activities and not social and entertainment activities. Now, by doing so, like for example, in a country like India, about 70% and more are people who live for day-to-day wages, and another 10 to 20% of them are mainly for month-to-month earnings who live for their rentals, school fees, families. So the emphasis that Government of India laid was that while we continue to work towards reducing the positivity rate and the R factor, we will need to focus on the economy at this juncture. And the most important emphasis that we've been talking about is that every economic zone will need to be run like a hospital or a clinic. And that's the most important aspect, that you cannot differentiate yourself from another business thing. All you need to focus is that whichever centers are running, whatever businesses, shops, they will need to run this as though they were running a clinic or a hospital. The second thing, and this first phase is called the safe reopening. Then comes the safe transition. If the positivity rate continues to be less than 5% across the state, in that case, we now know that we can slowly open up for social and entertainment activities in a very restricted manner, which is what in our state we are currently doing as per the Technical Advisory Committee guidelines. The final phase is to ramp up vaccination so that we touch the magic number of anywhere above 65%. Now, this is called the safe state. So again, reiterating the fact that the end of circuit breaker model of Singapore talked about three aspects: safe reopening, safe transition, and safe state. I think in a systematic manner, we would need to address the community in the same order of encouraging economic activities, but not social and entertainment activities. And at the same time, give a lot of emphasis to education, which we've been talking about in our state and in the Government of India's report, that the four groups of children, the children who are urban children, the children who are rural children, street children, and special needs children, all of these need to be addressed together in order to give complete holistic justice to the management of the pandemic.
So it seems lots of holistic plans there with the government, and we do hope that it really works in stemming the tide also as vaccinations continue. We would like to thank you so much and hope that you can join us again in the nearest future. Thanks a lot for joining us. Dean Center for Academic Research, HCG Center, Cancer Center, Dr. Visha Rao. Thank you for joining us on the program.
Thank you. Thank you.
COVID-19 vaccine booster shots are not appropriate at this stage in the pandemic. This according to a report in The Lancet published today. An expert review of scientific evidence to date has concluded that vaccines are effective enough at preventing severe COVID-19 and that there is no need at the moment for the general population to be given third doses. Let's take a look at the global update.
We begin in Britain, which top medical advisors recommend that all 12 to 15-year-olds receive a first dose of COVID vaccine, citing the benefit on avoiding disruption to education after a vaccination panel had said the decision was finally balanced. The advice paves the way for the broad vaccination of children aged 12 to 15 in Britain, after the Joint Committee on Vaccination and Immunization earlier in the month decided against making the recommendation. New Zealand has announced that the 1.7 million people in its largest city, Auckland, would remain under another week of lockdown to control the spread of the highly infectious Delta variant. Prime Minister Jacinda Ardern says Auckland will stay in a level 4 lockdown until September 21st. After that, the city will move to level 3, which means curbs will be eased slightly, but offices, schools and public venues will stay shut. Neighbouring Australia says the pace of COVID-19 vaccinations in its state of New South Wales has slowed as first dose coverage nears 80%, calling on the unvaccinated to get their shot soon or risk missing out on freedoms when curbs ease. Authorities have promised to relax tough restrictions for the state's 8 million residents once two-dose vaccination rates hit 70%, expected to reach around the middle of October.
Our strong message today from the public health team, from myself and the New South Wales government, is come forward and get vaccinated.
Finally, millions of Brazilians are struggling to make ends meet with hopes of a swift recovery from the COVID-19 pandemic, dashed after recent economic statistics showed a contraction in Latin America's largest economy. Brazil's economy contracted slightly in the 3 months to June, stalling more than expected as the second wave of the pandemic hurt demand.
Continue to take responsibility. You can visit our website. It's channelstv.com for breaking stories and also a better understanding of the pandemic. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.